Hi, my name is Dr. Affan. I'm a pediatrician with Angel Kids Pediatrics in Jacksonville, Florida. I'm going to be talking to parents about antibiotics. This topic is really very important. As a pediatrician, I know it's really very important and a very touchy subject for a lot of parents and a lot of moms. I know a lot of moms, they are coming rushing to our office with a baby that they are carrying in their shoulders, and the baby has a fever, and they come to our office, and we sympathize a lot with them. We take it serious. We do a lot of work to examine their kids, and we know they look at our eyes, and at the end of the visit, if they don't see a prescription for an antibiotic, they feel like, we did not get the antibiotic. Where is the antibiotic? I came to the office for this antibiotic. So it's really very important, and I know people are listening to me and laughing if they are pediatricians or they are parents, because this looks to be a big dilemma, like, where is my antibiotic? I needed this antibiotic. Why did I come and paid my copay to come to the office? You know what? Let me tell you something. Your physician might have did you a big favor by not writing you an antibiotic, and I'm going to explain to you why. Let us just talk a little bit about antibiotic first and understand what antibiotics are. And once you know about antibiotics and what they are and why do we use them, then you would understand that not necessarily every time that a kid, God forbid, or even an adult or a human being is sick, he or she would need antibiotic. Antibiotics are basically, in a very simple language, are medicines to treat and treat infections due to some bacteria. And bacteria are germs. We do have some different types of germs, are either bacteria or viruses. They're completely different. Even bacteria, there are some good bacteria, like we have in our intestines some good bacteria that will help us to digest our food and absorb our food, so they are not bad. We don't need to give it antibiotic to treat. Sometimes we put even bacteria in our food, like in yogurt, to help us to have a clean our intestines. So there are some good bacteria, and there are some what we call pathogenic bacteria that can cause harm and can cause diseases for us. And also there are what we call viruses. Viruses are some organisms and germs that do not have, unfortunately, most of them don't have treatment. They don't need any antibiotics. Antibiotics per se are medicine just to treat bacteria. Now, when we have a disease, this disease is either going to be a bacterial disease or a viral disease. So it is up to a physician when we do an assessment on a condition. And then I will take an example for a kid, for example, or somebody who has an illness that can be an upper respiratory infection with a runny nose that has a clear discharge from the nose with a wet cough and some fever that's fluctuating up and down and comes for a couple of days. This might be a completely viral picture. So what's going to happen if I'm going to just give this antibiotic and antibacterial medicine for this kid? This is not going to cause any benefit for this kid. On the contrary, actually, what I'm causing by doing this, I'm causing some resistance for a bacteria in the future that I might need to use that antibiotic. Meaning that if in the future that I'm having a real bacteria that I'm going to need to use this weapon, which is the antibiotic, this bacteria has already started to taste, if I may say, that antibiotic little by little when there was no infection with that bacteria, but I just used it for a small viral illness that I did not need to use it for, and they start to create some modification in their genetic makeup, and in the future when I need it for them, then boom, they just became resistant for it. So my weapon became ineffective or not effective against them. And this is what we create, what we call creating a resistant to that antibiotic. Resistant to antibiotic is really a huge public health dilemma globally. Through the entire world, we have a problem with creating resistant to antibiotics. So there are lots of side effects for antibiotics as well if we use them unnecessarily. Like it can cause diarrhea, it can cause stomach upset unnecessarily as well. It can cause an allergic reaction. So I can have a skin rash, I can have, God forbid, an anaphylactic reaction if I use them unnecessarily and I use them with no rationalization for the reason why I need to use them, besides of what I mentioned to you about creating those bacteria with a lot of resistance to them. So please be careful about using antibiotic. Please talk to the physicians, and I would be happy when my physician is explaining to me this is a viral illness, we don't need an antibiotic. He or she saved my money, saved my child from a medicine and a possible side effect and a possible antibiotic resistant, and saved my community from overuse of a medication that might not be used. There are a couple of tips that I would love to share with parents. Please do not use antibiotics and share it with other family members. We see this all the time happening, and please make sure this is not a common practice that people do, that I start an antibiotic because I had it in the refrigerator because the sibling of my kid, or he had his older brother or older sister had been prescribed this medicine long time ago and I just found it and I started it before I came to the doctor. This is completely wrong. Expiration date might not be the same antibiotic that is needed for this condition right now. Please do not use an antibiotic that has been sitting at home. Sometimes an overdose could be an issue for us. Get rid of an antibiotic if you finish the dose as the prescriber or the physician who prescribed it to you. Whatever is left over, you have to get rid of the rest of that. Do not share antibiotics between family members. Do not use antibiotics, and if the symptoms have been improving and if it had been prescribed for a certain time, like 7 days or 10 days, please finish it as prescribed by the physicians. If there are any side effects happened due to using the antibiotics, go and report this immediately to your physician. And by doing this and following these instructions and listening to your physicians and following all the good stuff that your physician is telling you about, together we can create less resistance to antibiotic and live in a healthy community. Please follow us up in our YouTube channel for more tips for the week.